I'm Rowdy Hatch. I'm a physical therapist here in the Acute Rehab Center, and I treat patients on a daily basis. We treat them for up to 3 hours a day, 5 to 6 days a week. So we don't see a lot of primary diagnoses here with Parkinson's, but we see a lot of people with secondary that have had something else go on, whether it's a stroke or whether it's some other surgery or something, and then they've come here and they have a secondary diagnosis of Parkinson's. And they usually throw those patients my way because I'm Parkinson's certified. So it's a neurodegenerative disease that primarily they have a decrease in dopamine, which is a neurotransmitter in their brain that regulates heightened emotions with when somebody's happy or they've eaten something that's, chocolate, for instance, or something that makes them feel good. Sexual desires, those type of things are dampened when they have low dopamine. But also with movement, they struggle with movement, specifically in initiating movement. So when they go to move, to walk or to transfer or to do daily activities, then they have a decrease in that movement, and they struggle, they fall, they can't function like they used to. A lot of them have tremors, which also affects some of their movements. So eating, those type of things are tough because their hands shaking all the time, and so it's tough to do some of those, brushing your teeth or eating or combing your hair or anything like that, shaving. Those things can be difficult. We can give them adaptive equipment, and also exercise has been shown to decrease some of the symptoms as well. Depending on how early you get to it, if they're fairly early in the symptoms, then it is very successful. It can slow down the symptoms and also slow down the disease process itself. Exercise in itself, it increases dopamine, which is what they're struggling with, and so it helps slow down the disease process and helps them so that they can maintain a level of function long past what they would if they didn't do that. No matter what position they are in the disease, what level they are, you can always make it better. And so if nothing else, I can give them exercises to do every day that will improve their function, improve their movements, so that they can have a better lifestyle.